Crouse Hospital is a medium-sized, non-for-profit hospital. We are best known probably for our neonatal intensive care unit. The program here at Crouse in reducing radiation dose in the NICU is really a collaboration with the NICU and the radiology department. We looked at how we could reduce dose to the other babies in the NICU and the staff and parents nearby. And that's where the grant came in and allowed us to purchase shields that we could then place between the NICU bassinets.
The most severe babies are in the A nursery that we have most critical. So we could do one of those babies at least 4 times a day. You're supposed to be 6 feet away, but in the NICU it's so compact, the babies are all together. There could be a baby over here, and then you're x-raying this baby over here, and then there's a nursing mother over here. So it's a very tight squeeze in between. We can't move a child because most of the babies are on breathing machines. And that's why we brought in these lead walls as a portable radiation safety. Most of us have children, so we have to look at it like we're looking at our child. And when we want to give this child the very best.
I think it's very beneficial that the AHRA provides grants to hospitals like Crouse Hospital. It allows us to fund projects in a way that would be difficult, if not impossible, to find capital equipment funding for. Allows us to do some experimentation and try to really improve patient care.
Methodist has been recognized by the U.S. News and World Report as one of America's top hospitals. The Commit to Sit program is a simple connecting to the patient.
Our whole premise in starting this program was really about keeping patients safe and simply just sitting with patients and really interacting with them on a different level than what you normally would think about in a healthcare environment, for them to give you information that you may not otherwise get. And in the end, it really is about keeping the patient safe. And we have found phenomenal results with what we have been doing.
When I first heard about the Putting Patient First program, I was really excited about it. I'm like, what an awesome program to put an innovative idea like Commit to Sit out to the healthcare community. And so the Methodist Hospital Radiology Shared Governance, we went with it and we applied and we won the grant.
The Commit to Sit program has changed our relationship with patients, and it's something that we're committed to for the future.
Akron Children's Hospital is the largest pediatric healthcare provider in Northeast Ohio. For our grant, we chose to focus on increasing the patient's radiation knowledge. After each patient has an examination, we can give a much better estimation to the parents of what that dose is, keeping that as low as possible, and then create a record for the patient to keep with them.
Well, the idea of this whole study came about by the increased concern about radiation dose by not only families, but ordering physicians. So we decided to acquire that data.
And it compelled us to standardize our fluoroscopic procedure across the board to minimize radiation dose to everybody, because now we are all following similar procedure. And since Akron Children's has multiple other campuses, these standards apply to all the other campuses.
When I first heard about the AHRA Toshiba Putting Patients First grant program, I thought it was a great combination for the AHRA and Toshiba to help out hospitals and imaging places to make things better for the patients. So we were very excited to try and do something at Akron Children's Hospital. After completion of this project, we would like to move into the CT area, it's a larger concern than the fluoroscopy area, and see if we can replicate the study in regards to CT so that we can let the patients know exactly how much radiation they receive in a CT scanner as well.
Mission Health serves Western North Carolina, and the Reuters Outpatient Center is the pediatric subspecialty center for pediatric outpatient care. So this grant helped us provide the materials and the support to test therapeutic play and its relationship with anxiety level.
We used the Toshiba grant to purchase our MRI child-sized simulation table, as well as our patient puppet. And we were also able to bring in a professional puppeteer to train us on how to use the puppet.
In determining the outcome of the exam with therapeutic play for MRI, our key metric has been 2 things from the perspective of a radiologist. 1, did we answer the clinical question? And the second metric from a radiologist perspective is the quality of the imaging. Was there degradation by motion? Was the exam interrupted? And in all of those circumstances, the outcome is excellent.
Without programs like this, we would not be able to offer the type of quality care and the type of patient experience that these foundational grants make possible.